Snoring. Is it just a harmless nighttime noise? Or could it signal something more serious like sleep apnea? Far too often, snoring and sleep apnea are confused or even considered interchangeable. Let's clear this up. Not everyone who snores has sleep apnea, and not everyone with sleep apnea snores. Hello, I'm Michael Grant White, founder of Optimal Breathing. Today, let's dive into what sets snoring and sleep apnea apart, and how understanding your breathing could change your sleep for the better. First, let's talk about snoring. Nearly half of all adults snore, and for about a quarter of them, it's a regular thing. Snoring happens when airflow is partially blocked during sleep, causing the tissues in your throat to vibrate and create that familiar sound. While snoring can be frustrating, especially for your partner, it's often harmless. Occasional snoring doesn't usually disrupt your overall health. But sleep apnea is a different story. Obstructive sleep apnea, or OSA, involves repeated pauses in breathing during sleep. These pauses happen because your airway becomes fully or partially blocked and your body struggles to reopen it. People with sleep apnea often wake up gasping for air or twitching, which disrupts their sleep cycles. And it doesn't stop there. Untreated sleep apnea can lead to fatigue, mood swings, depression, and even more severe health issues like heart problems. So, how do you tell the difference between simple snoring and sleep apnea? Let's compare. Snoring, continuous airflow with vibrations, doesn't necessarily disrupt sleep. Sleep apnea involves pauses in breathing, causes sleep disruptions, daytime fatigue, and mood changes. If you wake up feeling tired, unrefreshed, or find yourself excessively sleepy during the day, that could be a sign of sleep apnea, not just snoring. Here are some red flags to look out for. Loud, frequent snoring, pauses in breathing, gasping for air during sleep, morning headaches, or difficulty concentrating. If you notice these symptoms in yourself or your partner, it's time to consult a healthcare provider. Sleep apnea can seriously impact your quality of life if left untreated. Did you know breathing techniques like diaphragmatic breathing can help alleviate sleep apnea symptoms? Studies show these exercises can strengthen your diaphragm, improve lung capacity, and reduce stress, all of which may reduce sleep apnea events. Let's break it down further. Increasing diaphragmatic muscle strength. Regular practice strengthens the diaphragm, making it more effective in maintaining proper airflow during sleep. Improving muscle coordination. Diaphragmatic breathing trains the diaphragm and other respiratory muscles to work together efficiently, reducing breathing difficulties. Reducing stress and improving relaxation. This technique activates the body's relaxation response, reducing muscle tension and promoting deeper, more effective breathing. Improving lung capacity. Taking deep breaths expands the lungs fully, increasing oxygen intake and reducing the effort needed for each breath during sleep. Deep intentional breathing isn't just relaxing, it can be life-changing for your sleep. Strengthening your diaphragm may improve your breathing efficiency and help you get better rest. The way you breathe plays a critical role in your sleep quality. That's why we developed the Optimal Sleep Program, included in the Optimal Breathing Kit, to help you unlearn poor breathing habits and wake up rested every day. By practicing the techniques in the Optimal Breathing Kit, you can strengthen your diaphragm, improve relaxation, and unlock deeper, more restorative sleep. It's an easy step that could change how you breathe and how you live. If you think you might have sleep apnea, don't wait. Talk to a healthcare professional. This can help you incorporate CPAP therapy, lifestyle changes, or other treatment options alongside optimal breathing techniques into your sleep apnea action plan. And for snorers without sleep apnea, small adjustments like sleeping on your side or practicing optimal breathing techniques can reduce those nighttime noises. Remember, understanding the difference between snoring and sleep apnea is the first step toward better health and better sleep. And don't forget, learning to breathe the right way with the Optimal Breathing Program can help you sleep better and wake up refreshed. Don't let snoring or sleep apnea impact your quality of life. Start your journey to better sleep today. Want to know more about Optimal Breathing Self-Mastery Kit or place your order? Visit optimalbreathing.com today or reach us at 704-597-6775 or hello@optimalbreathing.com. Thanks for watching,